Hello friends, welcome to Healthwizac Medical Concepts Simplified. In this video, we will learn about myasthenia gravis. Myasthenia means muscle weakness and gravis means severe. And so goes the disease manifestation in the form of severe generalized muscle weakness. Myasthenia gravis is an autoimmune disorder affecting neuromuscular junction and is primarily caused due to decrease in the number of acetylcholine receptors at the neuromuscular junction. Its severe form involving diaphragmatic and respiratory muscle weakness is termed as myastheniacrisis and is a medical emergency requiring intubation and mechanical ventilation. Acetylcholine is a major neurotransmitter which helps to conduct the nerve signals from neurons to muscle groups leading to their muscle contraction, which is later on hydrolyzed by acetylcholine esterase enzyme. In myasthenia gravis, due to primary decrease in the number of acetylcholine receptors at postsynaptic muscle group, these signals are not conducted and hence giving rise to muscular weakness. While primary cause of myasthenia gravis remains autoimmune, predominantly anti-acetylcholine receptor antibody, other causes include anti-MuSK antibody, that is muscle-specific kinase antibody, and LPR4 antibody, that is low density lipoprotein receptor related protein 4 antibody, thymic tumors like thymomas, and even penicillamine drug related. Whereas factors like infection, emotional stress, pregnancy, surgeries may precipitate the event. Based upon the region involved, myasthenia gravis is primarily divided into two types, namely ocular myasthenia gravis involving only muscles of eye and generalized myasthenia gravis involving muscle group other than eye. Based upon the region involved and the severity of muscle weakness, myasthenia gravis is classified into 5 types. Type 1 includes ocular muscle weakness with no other muscle group involvement. Type 2 includes ocular muscle weakness along with mild weakness of other muscle groups. Type 3 includes ocular muscle weakness along with moderate weakness of other muscle groups. Type 4 includes ocular muscle weakness along with severe muscle weakness of other muscle groups. And type 5 involves respiratory muscle weakness and diaphragmatic muscle weakness, giving rise to myasthenia crisis. Symptoms of myasthenia gravis includes the following: weakness or fatigue late in daytime and improves post-rest or sleep. Diplopia and ptosis primarily in ocular myasthenia gravis. Altered speech due to palate weakness, difficulty in swallowing, nasal regurgitation, aspiration of liquids, and respiratory fatigue in case of myasthenia crisis. Diagnostic tools in myasthenia gravis is as follows: history and presentation of generalized muscle weakness with intact reflexes serves as a helpful tool in diagnosis. In OPD or IPD setup, ice pack test is also very helpful, in which after keeping the ice pack over ptotic eye, it shows improvement in ptosis. Blood tests include anti-acetylcholine receptor antibody, anti-MuSK antibody. Electrophysiological tests like repetitive nerve stimulation and single fiber electromyogram serve as a great tool in diagnosis of myasthenia gravis. Anticholinesterase test using injection adrophonium is also used in diagnosing myasthenia gravis. Pulmonary function test proves helpful in judging respiratory impairment. Other investigation helpful in figuring out the trigger factors may include CBC, LFT, RFT, ABG, infection markers like CRP, PCT, blood cultures, and radiological imaging in case of suspected tumors. Friends, now let's have a look at the treatment approach of myasthenia gravis. Treatment approach can be divided into medicinal and surgical part. Medicinal approach includes two major parts, that is anticholinesterase medications and immunotherapy, whereas surgical approach includes thymectomy or surgical removal of thymoma in case of suspected tumors. Anticholinesterase medication include pyridostigmine, which helps in stopping the enzymatic hydrolysis action and thus prolongs the effect of neurotransmitter acetylcholine at neuromuscular junction, and is given in a dose of 30 to 60 mg 3 to 4 times a day. Selection of immunotherapy usually depends upon the severity of disease presentation and expected result time, and is further subdivided into 3 groups of immediate effect, intermediate effect, and long-term effect. In acute scenarios like myasthenia crisis, where immediate results are expected, Treatment approach includes IVIG therapy, which is given intravenously in a dose of 2 gram per kg given in divided doses over 2 to 5 days period. And second is plasmapheresis, which helps in separating the pathogenic antibodies from blood cells and is given in a course of 5 exchanges, each involving 3 to 4 liter per exchange, and is given over 10 to 14 days time period. Medications giving intermediate results include glucocorticoids, primarily prednisone, which is initially started with single dose of 15 to 25 mg per day and is slowly stepped up by 5 mg per day every 2 to 3 days to reach a maximum dose of 50 to 60 mg daily. And once the symptoms are controlled, then it is slowly tapered down by 2.5 to 5 mg per month to reach a minimum effective dose. Second category includes calcineurin inhibitors, which includes cyclosporine, which is given in a dose of 4 to 5 mg per kg per day, and tacrolimus, which is given in a dose of 0.07 to 0.1 mg per kg per day. Long-term or delayed results are achieved through following medication groups. First is mycophenolate mofetil, that is MMF, which inhibits the lymphocytic proliferation and is given in a dose of 1 to 1.5 gram twice a day. Second drug is azathioprine, which is initially started with a dose of 50 mg per day and is gradually stepped up to 2 to 3 mg per kg of total body weight. Third is rituximab, which is a monoclonal antibody binding to CD20 molecule of beta lymphocyte and is given in a dose of 1 gram IV on 2 occasions 2 weeks apart and can be repeated periodically. And last is eculizumab, which is also a monoclonal antibody which works by complement inhibition of complement C5. Treatment of myastheniacrisis involves aggressive intensive care management with IVIG and plasmapheresis therapy approach along with ventilatory assistance and broad spectrum antibiotics in case of suspected secondary infections. And once the patient comes out of acute phase, pulmonary physiotherapy should be started at the earliest. Friends, if you want to know more about ventilator basics and management, please click on the I button at the right top corner of the screen or click the link given in the description box below. Finally friends, let's have a look at the differential diagnosis of myasthenia gravis, which includes Lambert-Eaton myasthenic syndrome, neurasthenia, hyperthyroidism, and botulism. So friends, this brings us to the end of this topic. Hope you find this information valuable and applicable in your clinical practice. Please do like and share this video and hit the bell icon for latest updates. And for more such informational videos on medical topics, please subscribe to YouTube channel Healthwizac, Medical Concepts Simplified. Thank you.